Hello, everyone. My name is Zarina Shafi. I am currently enrolled in the BS to DNP program with a concentration in pediatric health at the USF College of Nursing. Today, I will be interviewing Dr. Jordan. She is the Vice Dean of Undergraduate and Global Programs at the USF College of Nursing. Today, we will be discussing global health and the COVID-19 pandemic for the In Their Words series. So, Dr. Jordan, thank you so much for being here. I'm just going to ask you to tell me a little bit about yourself and how you got into the field of global health.
Sure. Thank you, Zarina, for that question. I really developed an interest in global health as a very junior faculty when I was at Johns Hopkins School of Nursing. And as my career developed and my scholarship in the field of maternal child health developed, I began to conduct research and develop grant proposals with my colleagues at the College of Public Health. And my work really became global. But it really was that my Text for Baby program model that became used as a program model for mHealth strategies that was implemented globally. And that really provided me many opportunities for global work. I also had the opportunity to provide curriculum consultation for international nursing programs in Turkey, Australia, and Uganda. So it was really a combination of all those experiences that led me to want to do and conduct more work in the global area.
That sounds really interesting and honestly really cool. So, in your opinion, why do you feel that global health is important?
Well, global health is an area of study, research, and practice that places a priority on the importance of health and achieving equity in health for all people worldwide. We may have different religions, different languages, different skin color, but we all belong to the human race. And global health brings us all together.
That was really awesome, and I completely agree too. What kind of global health efforts have you been engaged in before the pandemic started?
Wow. Well, it's been quite a ride, to be honest, Serena.
Uh-huh.
Uh, so, as the vice dean of undergraduate and global programs, I had to lead the effort of getting students their clinical experiences. And so much of my focus was really on getting our students back into clinical, making sure that they stayed on their pathway, that they graduated, and that they had rich clinical experiences. And so, as the vice dean, that was part of my work and continues to be part of my work. But I also have a real interest in, I know you know this from our work together, I have a real interest in maternal child health. So I've also had the opportunity to work with my nursing organization, AWAN, and educate pregnant women about the challenges of being pregnant during COVID-19. So it's really been twofold in the educational arena as well as my scholarship area.
You sound very busy and very active also. What has been your role in fighting the COVID-19 pandemic?
Yeah, I think in fighting the global 19 pandemic, um, you know, again, making sure that our nursing students are well educated and infusing that education about COVID-19 and appropriate safety for not just our patients and their families, but also for our nursing students and the nurses out there practicing. And so I've taken a real interest in making sure that all our healthcare, especially nursing, is well prepared to care for those folks with COVID-19.
Awesome. In your opinion, what must happen to end this COVID-19 pandemic?
Well, I don't have a crystal ball. I don't have a magic wand. Um, so I'm going to give you the best answer I can.
Right.
I do think when we think of global health, I think that an effective and comprehensive global disease surveillance and response capability is required. And again, I'm going to go back to global health. I do believe that WHO, our World Health Organization, has a lot of experience, a lot of long-term data on numerous infections, disease, epidemics, and really has the mandate to lead and coordinate the international effort in a global response that, of course, would affect um, really internationally how we deal with this pandemic. And of course, there's the vaccination or the vaccine. And of course, I hope that our scientists are able to produce a vaccine that is effective and safe. Um, as an educator, and as a nurse, our role is really to help our patients and families and everyone we touch understand the safety of um, the vaccine and encourage vaccination.
Absolutely. Well, those are all the questions that I had. Thank you so much, Dr. Jordan. It was a pleasure to do this interview with you.
Thank you, Zarina.